Good afternoon, everyone. My name is Dr. Lindsay Ogle. I'm a board certified family medicine and obesity medicine specialist, and I am here with Sarah Udell. She is a dietitian who is going to be sharing a lot of really helpful information with us. So I will just let her get started.
Hello, everybody. Thanks for joining us. I wanted to come on here today and talk just kind of basically about macronutrients, calories as well, and then their role in sustainable weight loss. So a quote that I like to, I really enjoy when talking about sustainable behavior change is success is the sum of small efforts repeated day in and day out. And that just for me really encompasses what lasting behavior change is all about. It's those tiny things that really add up and make a huge difference in our life. So I'm Sarah Udell, like Dr. Lindsay said. I started my private practice last year, and I'm really passionate about helping busy women and moms, especially, but really anybody who wants to stop yo-yo dieting and just finally achieve their nutrition goals, their weight loss goals, and never have to go on another diet again. My background is, like she said, a registered dietitian. I have both a bachelor's and a master's in nutrition. And I'm also a certified diabetes care and education specialist as of last year. And just recently, last month, became a certified personal trainer. So lots of lifelong learning on my end. All right, so to get into it, I think everybody knows what calories are. It's really basically just a unit of energy. It's how we measure the energy that our body needs. And we can estimate this in a number of ways. A lot of dietitians utilize evidence-based equations to get a pretty good estimation of somebody's energy needs. Other options would be BMR testing, which is a little bit more accurate and specific to the individual. And there's actually a couple businesses that have popped up in the last couple of years that I've noticed, especially in Missouri, both around Kansas City and St. Louis area, that offer BMR testing to consumers directly. So the names of those would be Fitness City and DexaFit. Those are the two that I'm familiar with. And then also, if you don't have one of those local to you and you're interested in doing something like this, check with your local university's sports medicine lab. They might offer some these kinds of tests to the public. Another way to estimate energy needs is just to track intake and really monitor what your weight's doing. I'd say give it like 2 to 3 weeks and really look at averages of your energy intake and your weights versus the day-to-day fluctuations and compare those to see if your if your weight's stable, you can guess that your energy intake is your maintenance amount. And it's really important too, if you're not familiar with a lot of these things, to work with a registered dietitian or health professional that's knowledgeable in this to really get you on the right track so you're not severely underestimating your energy needs. And then, of course, for weight loss, a calorie deficit is required. No way around that. So we do need to consume less calories than our body needs to lose weight over time. And when I work with clients, I really try to keep the calorie deficit as small as possible, but still seeing results. Because the more calories we can, keep on board, the less muscle we're going to lose during weight loss, the happier we're going to be. It's going to be more sustainable for us long term. So there's really a lot of positive things that can come out from keeping your calorie intake as high as possible. All right, and just a recap of like where our energy needs are coming from. The biggest part of our energy requirements comes from the BMR or the basal metabolic rate. And then the daily movement is the other kind of larger chunk of our energy needs. And that's all those little things that we're doing, like fidgeting or like I'm doing, talking with my hands. If we're walking around a lot, if we, are doing yard work, housework, those are categorized as that daily movement. Planned exercise is really not a huge part of our energy needs. It's about 10% or so. So I work with a lot of people who tell me, gosh, if I could just exercise more, I lose weight, no problem. And really, I mean, yes, exercise is beneficial, don't get me wrong, but it's not a huge part of our energy needs. And then that last part is the thermic effect of food, which is really just the energy that our body requires to digest and utilize our nutrients from our food. All right, so some of the tools that are useful when you're tracking your calories or macronutrients would be some sort of tracking application. There's 5 that I included here. The 3 on the left are MyFitnessPal's on top, Lose It is the one in the middle on the bottom, and then Chronometer is the one on the left on the bottom. And those all have both free and paid versions, if you're interested. And then the 2 on the right are both paid versions, but they're roughly, less than $10 a month. And they come with some additional features. Both of those, I believe, have a coaching piece to their app, and they actually help you adjust your macronutrient intake based on the data that you're inputting. So whatever your calorie intake is and your weight changes, it will adapt, based on your metabolism, according to your goals. So it's a really nice extra benefit for that. Other tools that I recommend for individuals who want to track their food would be a food scale. I really prefer that over the measuring devices like measuring cups. They're just not as accurate. And I say, hey, if we're going to track our food and measure it, let's do it right and get it as accurate as possible. So that's something that I do utilize with some of my clients. Other approaches, if you're just really not into tracking and that's not something you want to do, there's other approaches. There is visual guides that use household items or different parts of your hand to estimate portion sizes. The plate method is one I use a lot with people that don't want to track, because it's really just basically a template to a balanced meal and helps people get those portions a little bit more in line with their goals. And then another thing that I utilize with a lot of my clients is mindful eating. And that's just really, if you've been dieting for years, if, maybe from your teen years, and you're really maybe out of tune with your body and you can't necessarily tell when you're hungry or tell when you're full. Mindful eating is a great tool to really get you back in tune with your body and help you be more mindful during meal times. And then the last thing, I really honestly use this with all my clients as well, is tracking those non-scale victories, the non-scale progress, like how we're feeling, our energy level, how our clothes are fitting, maybe taking progress photos, maybe taking measurements even. So really looking at the bigger picture here. And, most people don't only care about the number on this scale. They really want all the benefits that come from improving their body or improving their health and making those changes to their lifestyle. So tracking the non-scale progress is really helpful there. All right, so getting into the macronutrients, protein. I think protein has the best marketing campaign of any of the macronutrients. Everybody, knows all about it, but you get about 4 calories per gram of protein. And of course, some super important roles in the body. Tissue growth and maintenance is a really big one. Enzyme production, hormone production, and many others as well. During weight loss, protein is really beneficial because it does help us feel fuller longer. And especially when we're reducing our calorie intake, hunger is something most of us are wanting to avoid or at least minimize as much as possible. It also actually requires more energy than carbohydrates or fat to digest. It's about 20 to 30% of the calories from protein are actually utilized for digestion. And then also, just to minimize muscle loss during a calorie deficit, protein is really essential here, just to make sure we don't lose more muscle than we want to. All right, so as far as needs go, there's a couple different things that we can look at when looking at our protein needs. The minimum required for a sedentary adult is 0.8 grams per kilogram, which that translates to about 0.36 grams per pound of body weight. So really not a lot there to prevent like a deficiency in protein. That doesn't necessarily mean that it's optimal for most people, especially active individuals. People who are strength training and trying to build muscle would really benefit from actually quite a bit more than that. The DRI recommendation for protein is a wide range, 10 to 35% of your total energy needs. So, not super helpful there either, as far as pinpointing a specific amount. So the research really is showing us that for weight loss, for preserving muscle tissue, and building muscle, 1.2 to 1.6 grams per kilogram of body weight is really kind of that sweet spot there. So that translates to roughly like 0.6 to 0.75 per pound of body weight, converting that to pounds there. But yeah, just so that's kind of a good range to be in. And then you can always adjust or, if you're working with someone, they can help you maybe change that around for you, your individual situation. And then for food sources, we really want to focus on kind of those leaner proteins. So like chicken, turkey, lean beef or pork, fish and seafood are excellent protein sources. Low fat dairy, so like Greek yogurt, cottage cheese, eggs and egg whites. And then some of these plant-based sources are also really helpful. Beans and lentils, nuts and seeds, and then soy protein as well. Some of the proteins that we want to just minimize in our diet, I don't say cut out because when we're talking about a calorie deficit, we really we want to still enjoy our food. And there's room in a healthy diet for some of these occasional high fat protein options like fried chicken or maybe full fat dairy or some bacon every now and then. So I'm a big fan of fitting all foods in moderation and not feeling deprived and cutting things out unnecessarily. And then for those that have kidney or liver issues, it's really important to check with your provider before you make any adjustments to your protein, as you would potentially have different recommendations here. All right, and then carbohydrates, kind of the macronutrient that gets the worst reputation, but carbs are really essential for energy production. They help us. They include fiber a lot of times. Fiber is found in primarily carbohydrate-rich foods. So it is important to get adequate carbohydrates for, if you're an athlete or you're just trying to exercise more and you want to have an improved performance there, carbohydrates can really be a game changer here. There's different types of carbohydrates, sugar, starches, those are kind of the main two carbohydrates. And then fiber is also included. Our body does not digest fiber. It's primarily a fuel source for our gut bacteria, but it does have a really essential role in our overall health. Some of the benefits of fiber would be, increased fullness, being able to eat a lot more food at your meal without exceeding your calorie goals. That food volume there is really helpful for fiber. And then it does help reduce risk of a lot of chronic health diseases or chronic health issues, heart disease, diabetes, certain types of cancer. Fiber has been shown to reduce risk for those. And it can also help keep you regular. So, reducing constipation, not a bad thing there. So as far as the recommendation, the DRI for carbohydrates, 45 to 65% of your energy needs should come from carbohydrates, and then 25 to 38 grams of fiber per day is what's recommended for adults. And I will say, I think about 90% of Americans are not meeting these fiber goals. So definitely something that we can improve on as a whole. Some of the best sources of carbohydrates, which coincidentally all happen to be high in fiber, would be whole grains, beans and lentils, fruits and vegetables. Those are all excellent sources of carbohydrate. The ones that we want to choose a little bit less often would be like refined grains, obviously anything with a lot of added sugar in there, candy, sugary beverages. These are things that we're typically exceeding our sugar intake for the day and they're really just not providing us with a lot of nutrients. All right, and the last main macronutrient is dietary fat, and this one comes a little bit more energy dense at 9 calories per gram. Fat's definitely important in our body as well. It's an essential nutrient required for absorption of our fat-soluble vitamins, and it can also help slow digestion and keep us fuller longer as well. And the DRI for this nutrient is 20 to 35% of our energy needs. Some of the best food sources would be avocado, nuts and seeds, fatty fish, kind of those whole food fat sources. I suppose some plant oils would fall under that as well. And then things to choose a little bit less often would be, your fatty meats, processed meats, high fat dairy, and some of the saturated plant oils like coconut or palm oil. All right, and water, I had to include water just because it's so essential for good health. Obviously, we're about 60% of water. Our body is about 60% water, so we definitely want to get adequate water intake. And it is important too for a lot of processes, digestion, metabolism, eliminating waste. And the recommendations for water can vary, about 9 cups per day for women, 13 per day for men. And really, I think water is more of like it should be individualized. And some people may need more depending on their activity level, maybe where they live. And it's good to just monitor your urine color to really figure out the best amount for you to maintain hydration status. And really all fluids provide hydration, and some foods do as well, especially your fruits and vegetables. All right, and the last one here is alcohol. Obviously not an essential nutrient, but something that, obviously a lot of Americans are consuming on a fairly regular basis. There is, it's recommended that we limit alcohol, especially for women, 1 drink a day or less, and then for men, 2 drinks a day or less for men. And then, yeah, obviously we know it's not super great for our health. It is a known carcinogen. So finding ways to minimize alcohol in our day, especially if we find that we're turning to it, maybe after a busy work day, stressful day, just want to take a break, kind of figure out, what your relationship with alcohol is. And if you're concerned about it and feel like you have a problem, definitely a good thing to discuss with your provider. But some strategies to help you reduce intake would be finding a good mocktail recipe. Luckily, the non-alcoholic movement is pretty strong right now. So there is a lot of non-alcoholic beers and wines and different mixed drinks out there on the market that kind of make it a little bit more exciting to drink. So if that's something you'd be interested in, that can be a great way to just reduce your alcohol intake. All right, and that was it. So kind of a quick rundown of the macronutrients and how they, relate to weight loss and a sustainable approach to weight loss. So now I'll take some questions.
Yeah, that was great. I love how you broke everything down and gave us a lot of information, but it was still um digestible and I think we all learned a lot. I love how you included water. I think that can get overlooked sometimes, and I agree. I don't tend to make for my patients a particular like goal amount or recommendation. I have them look at their urine color and look for a light yellow or clear color, and then you know that your body is hydrated because there are so many variables. So totally agree with that. And I was laughing when you were talking about protein having the best PR rep out there because I totally agree. Everyone is talking about protein. I've even seen like at Starbucks, I don't know if it's just where I am, but they don't even show the calories anymore. They show the amount of protein in like their food items. So very
Yeah.
interesting. But I was curious, do you, for your clients who are focused on, their weight management and their health, is there a particular macronutrient that you tend to focus on first or prioritize? And if so, why?
Yeah, so, I think really that depends on the individual. And that's what I love about working with people one to one is that there isn't, a blanket recommendation for everyone. There's no best macronutrient split up for weight loss. So it is very individualized. I do find that a lot of people that come to me that have been dieting a lot in the past are way under eating, especially fiber, especially carbohydrates in general. So a lot of times we'll kind of assess and see where they're at now and where we want to go, and we'll take 1 to 2 things at a time. So that's how that's how we make behavior change last, is taking it in small steps. So we'll, kind of isolate whatever it is that they're struggling with, and we'll create some steps to increase that. So, for example, if someone is not getting a lot of fiber in their diet, maybe we'll talk about how can we get some in, what you're doing now. So, potentially if they're doing oatmeal for breakfast, we'll see if we can throw in some chia seeds into their oatmeal. Or maybe if they're doing like taco night regularly, can we throw some beans in there with the taco meat to increase the fiber? So just different strategies like that. But I will say it is very individualized. Some people are struggling with protein intake, and fiber is another big one. As I mentioned before, 90% of us aren't getting enough fiber. So it's definitely an area for a lot of us to work on.
Yeah, I have two things to say about that. One is that I love that you started off with this being an individualized approach. And I think that every single person that I have talked to during this health summit has said the exact same thing. And that makes me know that I chose the right people to have this summit with, because I couldn't agree more. I say it's a red flag when you're hearing somebody say there is this one diet or this one supplement or one medication that is going to be the answer for everybody, because that is not the case. You want to work with somebody who is going to tailor, their knowledge that they have around health to create a plan that is right for you. So
Right.
just wanted to highlight that because that
Yeah.
approach is so important. Um,
Yeah.
and then second, making those small changes over time to make it sustainable, I think is very important as well. And the examples that you gave, I don't know if you noticed, but they were ones where you're adding to your diet rather than taking
Mhm.
away. And I think that just having that those kind of examples or those first changes to be additive rather than restrictive and taking things away can help so much from a mental health standpoint, and the relationship with food and with making it again lasting change. So yeah,
Yeah.
I think those are great, and thank you for sharing.
Yeah. Thanks.
um I guess that and that kind of answers the next question that I had, was about if there's one dietary approach that you recommend. But do you have any follow-up comments on that?
Um, I think it is very individualized. We know with nutrition, there's no black and white, there's no one size fits all. So, it really just depends on the person. But I generally take a more balanced approach. When people, want to drastically cut out a certain macronutrient or do things that are, very extreme and not sustainable, that's something that I try to work them away from and try to find more balance in their nutrition in general. But yeah, I mean, I think it's all super individualized.
Okay, great. Well, like I said, this was wonderful. I think super
Yeah.
helpful. Do you have any closing thoughts or last things that you'd like to share? And also, if people want to follow you or ask questions or work with you, how would they do
Mhm.
that?
Yeah, yeah. So one thing I wanted to mention earlier in the presentation, and it slipped my mind, is kind of that relationship with food piece. I take mental health very seriously, and if if we're tracking and where our approach to weight loss is impacting mental health in any way, we pivot. We definitely don't risk our mental health to achieve a weight loss goal. So that's a big thing that I monitor and focus on a lot. And I don't recommend tracking for people with a history of disordered eating or an eating disorder. It's definitely, the risks outweigh the benefits there for a lot of individuals with that history. So just something I wanted to throw out there that I forgot to mention earlier.
Okay.
But if you want to follow me, I'm on Instagram. It's at dietitian Sarah with two lines underneath. And then my website is www.dietitiansarah.com.
Okay, perfect. Well, thank you so much for taking the time to share your knowledge and experience with us. And I will include all of those links in the caption below. And I look forward to collaborating more in the future. So,
Yeah, definitely. I do as well. Thank you.
all